we got to the point where we said, well, what's the future? And really what happened is one of our patients' fathers, John Clarkson, had his children go through two different systems. One kind of went through the regular medical system, and one went through our system where they, just the whole experience of being treated first class as a patient, having the data collection done on their post-op visits, the hop test, the jump test, all of that very much impressed him. And he said, you guys have a good product. What about going to the next level? And so a vision started that we would like to get something bigger, not only in physical space, but in actually program delivery. And that was the seed of getting the foundation started. And that would be about 3 or 4 years ago. So we're at a point now where the foundation is up and running, and we are now trying to expand on our physical space as well as expand on our programming. This podcast, for example, is part of a whole series of initiatives of adding education, adding initiatives to the community as well as the broader community, the internet community. From a foundation perspective, we've really made great strides in education. We've done a lot of injury prevention work locally and created some posters and film, and that has been really rewarding to see the feedback on it. We get tweets from all over the world on enjoying some of the injury prevention initiatives. Where are we going in the future? I think what we have the unique ability to do is, with our machine that took 15 to 20 years to get going, if we continue our work on education and research, we can really take the advantage of what we've started and answer further questions in knee reconstructive surgery. We know ACL reconstruction and patellofemoral surgery is not perfect, and that there are advances to be made. And we feel we have a system that can ask questions about choices in surgery, choices in rehabilitation, choices in prevention, choices in screening of athletes. There are endless questions to be answered, but with the databases that we've started and are continuing to use, these are the sorts of questions that we think we can answer. We also enjoy collaboration with many centers across Canada and are doing collaborative research. We were just involved in a very special trial, multi-center trial on which was called Stability 1, which was basically adding an extra bit of surgery to an ACL reconstruction to see if that decreased the incidence of re-injury in the high-risk young athlete. And that has been very successful. And we're about to enter a second collaborative, Stability 2, with this multi-center trial. That's just an example of the potential of where we're going. But that, in a nutshell, is the creation of our foundation.